To what extent does the cost of healthcare negatively affect American residents? The answer to this question is great. According to Merriam-Webster.com, healthcare is defined as the efforts made to maintain, restore, or promote someone's physical, mental, or emotional well-being, especially when performed by trained and licensed professionals. To put it simply, healthcare has a high cost and it's not always easy to access for people.
The problem with health insurance is that it's very expensive. The price of insurance continues to rise, causing people to go bankrupt. The rise of uninsured people is also rising quickly. An article published by Crane Communications Inc., one of the largest business media companies, with 29 leading business states that that's supposed to help with insurance coverage, letting millions or more people to be uninsured. Approximately 41 million people are without coverage. This is leading to people going bankrupt because of the necessity that insurance really is, which people can't afford, causing them to buy expensive medicines that could lead them to bankruptcy. This gets stated by Joni L. Carnegie, a published editor of Young Adult Books, states that the U.S. Congress refused to act, and millions of working but uninsured Americans continue to live in fear of sickness or an injury that could leave them in bankruptcy.
Healthcare in America has become incredibly difficult to afford. The price is extremely high and continues to increase. The average person here spends $12,530 per year on healthcare alone. Additionally, around half of the adults in America struggle to pay this. It becomes worse for those who don't have health insurance, with it being basically impossible to afford for the uninsured. Sometimes also hospitals have hidden costs of up to $1,000 added on at the end that people are unaware of until it's been paid.
The people who are elected to govern this country continue to drag their feet on real reform. And when reform is enacted, it is under constant threat of budget cuts or outright abolishment. West Health and Gallup states that an estimated 112 million people, 44% of American adults, are struggling to pay for healthcare, and an estimated 93% feel that what they do pay is not worth the cost.
The United States healthcare system has its fair share of societal issues. In a study conducted by Time Magazine's Jamie Ducharme, it shows that despite spending more money per capita on healthcare than any other wealthy country in the world, the U.S. struggles to match life expectancy with other countries. The American Academy of Physician Associates shows that patient satisfaction is also suffering due to high cost, inaccessibility, and confusing logistics of U.S. medical care. In an article by Harvard Health, it says that when it comes to healthcare, it has a high cost and not the highest quality. Despite spending far more money on healthcare than any other high-income nation, the U.S. scores poorly on many key healthcare measures, including life expectancy, preventable hospital admissions, suicide, and maternal mortality. And for all that expense, satisfaction with the current healthcare system is relatively low in the U.S. The same article also states that it is a huge financial burden. High costs combined with high numbers of underinsured and uninsured people means many people risk bankruptcy if they develop a serious illness. Prices vary widely, and it's nearly impossible to compare the quality or cost of your healthcare options, or even to know how big a bill to expect. And even when you ask lots of questions ahead of time and stick with recommended doctors in your health insurance network, you may still end up winding up with a surprise bill.
Yeah, going on from Carlos, denied access to healthcare is also on the rise. Monica Das and Sandra K. Das, PhD graduates in economics, analyzed a table that showed in 2004, 71% of the U.S. population did not get prescription drugs due to the cost. So this is creating more prolonged illnesses due to less access to medical treatment. Premature death is also on the rise. Not surprisingly, the uninsured have less access to care and are in poor health and are at greater risk of premature death, states Dan Ryan, a professor at the University of Toronto, and Tom Sorrell, a PhD graduate from the University of Illinois. And then also, hospitals are losing precious revenue because insurance companies are not picking up the full cost of the medical bill from their customers. So nearly 1,000 hospitals have declined within the 20-year span, from depicted from a graph from Monica and Samuel Doss. And financial insecurity is also on the rise because of those surveyed, 31% said that a significant increase in their healthcare costs would make them consider reducing their regular retirement contributions. This was stated in an article published by NewsRx, a technology company with over 35 years of experience. This is a major problem because financial instability will become huge within the future when customers and just U.S. citizens are not able to afford the cost of retirement. So our first solution would be to incentivize hospitals This means hospitals would get higher status ratings and more money when they have a higher quality to lower cost ratio. So Liu, a master's student at Columbia University, Schumann, a professor at medicine at Stanford University, and Schneiker, an executive director at Stanford, state that the Mayo Clinic in Rochester, Minnesota is constantly ranked as one of the top performing hospitals in the country and was identified by the interactive tool by having maintained a 5-star rating all 5 years while decreasing costs. And also electronic health records incentivize payments to hospitals using EHR technology, which help better coordinate care and achieve improvements in quality, explained in an article published by CMS, a federal agency. So we are encouraging lower costs for consumers while also helping hospitals maintain revenue so they're not losing precious money. But however, we can't inflict this on every hospital, so prices may not drop substantially for people, so it might not seem beneficial to all.
Our second possible solution is price controls, and there are a few different ways this could look. The first way is price setting. According to KFF, a nonprofit organization that does journalism on health policy issues, the most common form of price regulation is price setting, which establishes a fixed price for each service paid to each provider. This would have healthcare set at a specific and unmoving price. The second way this could look is price caps. According to KFF, price caps limit the maximum price providers can charge for a given service or set of services without setting the exact payment amount. This would stop the cost from increasing over this limit once it reaches that. The third way is price growth caps. KFF says price growth caps constrain how much provider prices can increase over a defined period. This would stop it from becoming too much higher over a specific period of time. The pros of this solution are that there are multiple ways it could look, as well as it would stop healthcare prices from becoming too much more excessive. But the cons of this are that it could take a long time to establish around the country, and that it's really only effective on a short-term basis.
David Cutler, former Harvard professor and current faculty member, published in a paper in the Harvard magazine that says nearly half of Americans say they've delayed or skipped medical care because of the cost. If we enact a free guaranteed healthcare system, we would significantly reduce preventable deaths, health debt and poverty would be entirely wiped out, and health and happiness would be improved throughout the nation. Though this would be expensive, the current system is arguably more expensive due to its shocking inefficiency.
If our solution is implemented, more healthcare will be more obtainable and affordable, people getting better health service, more money going in for them, so better financially. And if not implemented, healthcare will continue to rise in costs, also causing people to go bankrupt and people being sick.
And these are our website pages.
All right, thank you very much.